My name is Rosie Wheen. I'm Head of International Programs for WaterAid Australia, and I'm here in Kampala, Uganda with Mr. Kampala himself, Robert Kampala, Head of Southern Africa region. How are you, Robert?
I'm doing fine. Great talking to you, Rose.
Likewise, Robert. So we wanted to capture some of your reflections after spending this week here in Uganda. What are some of the learnings that you've taken home after our visit to the urban work here in Kampala?
Rose, the visit to Uganda has been one of the inspiring visits, really fantastic. I'm glad that the IPD SMT meeting actually took place here in Kampala, Uganda. I was particularly interested in the work that we actually saw. One around the rooted advocacy that's happening in Bwaise. The group that we actually met, one could clearly see that they had actually been empowered and they are actually utilizing the skills that they have actually gained from the training and facilitation from one of the WaterAid partners, CD. This group was very clear around what are the changes that they wanted to actually make within their own communities, as well as understanding where the power lies and how they should actually go about it. So I think that to me was a classical case of how rooted advocacy should actually be done, with the communities taking the leadership, with the communities themselves defining what are the changes that they want to actually see in their own communities.
Thanks, Robert. And I think one of the things we really heard when we visited that group was the important role that CD, the partner, had played in empowering that group. Can you tell us a little more about your impressions of the work that WaterAid Uganda is doing with other sector actors and other partners?
I think what I found was the strong partnership that is existing between WaterAid and these key service providers. The collaboration that WaterAid has with these strong partners, as well as clarity on what is the role of WaterAid and what is the role of the water utility company and what is the role of the Kampala City Council. Again, I was quite thrilled by the passion and commitment in terms of really taking proper approaches by a water utility company. I think to me that was very interesting, and that's how it should be. Again, with the Kampala City Council, for them to actually set up a department which is looking at environment and sanitation, and really focusing on the preventive side of things, and having the director of that department really saying the way forward is not about curative. The way forward is about focusing on the prevention. Yeah. So I think that to me was again another inspiring moment, and I think that's how it should be, and that's how the city councils need to look at the role of water and sanitation, and how in terms of allocation of resources we need to really focus on the prevention and not on the curative side of things.
Yeah, and we've really seen, haven't we, that rights-based approach in action, with the community groups empowered and demanding their rights from the duty bearers and holding them to account. It's been a really fantastic demonstration of that simple model we use to describe the rights-based approach.
Exactly, Rose, you are absolutely right. That oftentimes many programs will tend to focus on the demand side. Yeah. But I think WaterAid Uganda is getting it right by ensuring that they look at both the demand as well as addressing issues from the supply side. Yeah. So I think that's the way it should be. And I think one thing that I would be saying is for the WaterAid Uganda program to really look at how can this actually being shared widely within WaterAid, because it's a best practice case and therefore it would be important for WaterAid Uganda to share widely around the current work and the partnerships they have with the service providers, how they're using that in terms of addressing the supply side as well as empowering communities using the rights-based approaches.
Yeah, and we did hear from Alice Ankur, the country rep, how they're trying to expand this model even just within WaterAid Uganda to the rural areas as well.
Yeah.
Robert, you mentioned something in there interestingly about what is WaterAid Uganda's role here, because we heard that there is a strong sector coordination group. We've heard that there's quite high coverage, water and sanitation. But what do you think going forward is the role, and what have we heard this week about what the sector thinks the role of WaterAid Uganda is, considering the high level coverage seemingly that there is here?
Yeah. I think WaterAid Uganda has got a role to play. Obviously, I think it became very clear that as much as the information tend to show a very high sort of coverage per se, and the sector seems to be functioning very well, but it also masks some of the challenges that are being faced by the sector. I think one critical area is around the inequity.
Yeah.
And therefore this is an area that WaterAid Uganda can actually demonstrate how to mainstream issues of equity and inclusion.
Yeah.
I think it's an area that could also add value to the sector, because in most cases you will find that most of the programs, issues of equity, issues of inclusiveness are not actually being proactively being considered in the designs of various water and sanitation programs. So WaterAid is one of the examples that's been providing leadership in this area, from our work in Asia, working in West Africa, Southern Africa we are doing something, again in East Africa, and I think that's an area, a niche that WaterAid Uganda needs to continue to occupy that niche and provide leadership in the sector in that area. The other area is around the research and the documentation, providing the evidence. For example, we need to provide the evidence to the government, to donors, to all other key stakeholders. What is it that is not actually working? Or what is it that is actually working very well? And being able to bring that to the table. So again, WaterAid Uganda can actually look at focusing at sustainability, using the post-implementation survey monitoring, doing those studies and taking the results to feed into the sector planning and programming.
Within WaterAid and the water and sanitation sector, the big challenge that we have around working in urban areas is that increasingly with population growth and the people moving to urbanized areas and the unplanned growth that happens in those areas, water and sanitation are critical issues, but we are grappling with how we deal with those. For example, the complexities of the communities that we work with, issues around land ownership, and also issues around one of my favorite topics now, fecal sludge management. How have you seen that being addressed here in Uganda?
Well, Rosie, you're right. Working in the urban is very sort of complex and also challenging because of one, there's so many stakeholders that are involved in urban setting, and the challenges that you have actually alluded to, the issues of urbanization, land tenure issues. Those are some of the major challenges because they affect the whole provision of also services. The challenges are not going to be solved by a single agency. It's about partnerships, it's about coordination, it's about collaboration. We need to engage with the service providers. What has happened here is where the National Water Sewerage Corporation has actually set up a proper unit within the national, within their own company. There's the whole issue around the sludge management, as well as solid waste management. I think we saw also efforts by the country program trying to address issues of solid waste management. There's a community-based organization in place that's actually trying to collect refuse and really taking the turning solid waste into wealth.
Yeah.
Very good concept, and we saw the briquettes that they are actually making. But I think there's a bit of challenge in that particular initiative. One of the challenges in that particular initiative is that it seems to lack a sense of clear direction how that group is going to be supported.
Yeah.
We saw very good passion, enthusiasm on the part of the community-based organization itself, but they need support. But we have also learnings from other country programs, like the Mozambique program has been doing something around solid waste management. So what are the learnings coming out of Mozambique in Maputo? And how can the learning from Mozambique help to improve the programming in Uganda? So we really need also to forge cross-regional learning between our various country programs. Rosie, we have spent 1 week here in Kampala, Uganda. I would like to hear from you. Are there things that, from your perspective, you think WaterAid in Australia could also support, could provide some learning to the program here in Uganda?
It certainly has been a week full of learning, Robert. I think I've learnt a lot seeing the progress of such a long and established country program on the journey of change that it has gone through as it's evolved over the years. One of the programs that we visited was a school wash program, and that was, I think, one of the courageous things that the country program did. They wanted to show us excellent examples of their work, but also areas of their work where they felt that they could be improved. And in that school, whilst we saw that they had done an excellent job empowering the board of management of the school management committee, there was a recognition that what there was lacking was coordination between what was actually implemented in the school. We saw that there were a number of different water sources that were constructed in the one school, some of which could create health risks because one was a bore not implemented by WaterAid, but another organisation. So that in itself created a really interesting discussion for us around the role of WaterAid and where does our responsibility end? If a program is not implemented by us, what is still our duty of care or responsibility? One of the things we also saw when we visited that school was the importance of menstrual hygiene, and that school was a dormitory a boarding school, so they had dormitories, and the matron was very proud to show us the sanitary pads that were provided for the older girls when they were menstruating. But again, the WaterAid Uganda team were reflecting on the toilets that had been constructed by another group, could have been improved to be more hygienic, but also to provide proper disposal for the girls' waste. And that's something that not only in WaterAid Australia's programs in Timor and PNG, but across the WaterAid family, we have put that real emphasis on menstrual hygiene. One of the things that we saw in the school was a fantastic display from the school hygiene club, and that to me was a real highlight. The children came and sang them gorgeous songs to us on the importance of hand washing, and I can just imagine, them going around their classrooms and singing to each other. And I think that that's a really important learning for us of how to effectively engage with children as agents of change around hygiene promotion. But a key challenge in the schools, and especially when you think of the context of Kampala, what is the condition that those children go home to? We found out that about 35 children were from child-headed households, so they'd lost their families, their parents to AIDS, and they were orphans. So it is a challenge to look at the whole school environment and the whole community environment and how we're supporting all children.
Yeah, I think you're absolutely right. We need it as an organization to really look at issues of menstrual hygiene management, not only from an inclusive point of view, but I think the strategic importance of ensuring that this is an important aspect of ensuring that girls are actually able to remain in schools.